On this last part of bleeding as an indicator of disease, before we can really talk about dysfunctional uterine bleeding, we need to learn some definitions. Menorrhagia is excessive bleeding during menses or bleeding for a prolonged period of time. Menorrhagia is irregular, frequent uterine bleeding, and a way to remember that is the metro is the same thing as the subway. The subway makes a lot of stops, but it's kind of irregular with the schedule sometimes. Menorrhagia is a combo of both those, and it's easy to remember because both words are kind of thrown in there together. To define polymenorrhea, we have to agree on what a typical menstrual cycle should be. In general, we say that females have a menstrual cycle every 28 days, or give or take a few days. It really depends on what is typical for each female, but when someone gets menstrual cycles that are less than 3 weeks apart, that's poly or many. Therefore, polymenorrhea is regular bleeding less than 3 weeks apart. Some of the causes of dysfunctional uterine bleeding are listed here. Take a second to look over the list because the next slide will start to talk about leiomyomas. Leiomyomas are probably better known as uterine fibroids. They are benign tumors that develop from the smooth muscle of the myometrium or the inside muscle layer. They typically will remain small and asymptomatic so that many women that have them do not realize that they have them. Between the ages of 30 and 50, we start seeing more leiomyomas. However, when females hit menopause, the incidence of leiomyomas actually decrease, and existing leiomyomas tend to shrink. About 30% of white women in the United States and about 50% of black women by the time they hit 50 years old have had a leiomyoma or uterine fibroid. So it's fairly common, although black women and Asians are 2 to 5 times more likely to get these leiomyomas than even white women, which is already fairly common. It seems that there's a correlation between leiomyomas and hormone levels, but this is one of those pathologies that is largely idiopathic. Sometimes leiomyomas run in families, so there's probably a genetic link. If the leiomyoma remains small and is not located in a vital spot, they usually do not cause a whole lot of major problems, but they do cause cramping and excessive bleeding, which is why we're talking about them in the first place. When talking about the larger leiomyomas, they can start compressing blood vessels, and as you already know, when blood vessels are compressed, blood supply and oxygen are cut off, and that can cause tissue death. Plus, when leiomyomas get big, they start pushing on other things, so a lot of times females will have abdominal pressure develop. Also, they have to urinate frequently because of the growth pushing on the bladder. Occasionally, this can cause dysuria. Since leiomyomas are slow growing, symptoms can develop over a long time. With leiomyomas, we would want a pelvic sonogram or an MRI to confirm the diagnosis. For treatment, it really just depends on the symptoms and how big it is and how old the person is and what their reproductive status is happens to be at the time. This is a drawing of all the possible places a leiomyoma can occur. In short, a leiomyoma can go anywhere in or around the uterus. This drawing might give you the impression that a person can have multiple growths at once, but that's rarely the case. Usually leiomyomas appear as a single mass. Endometriosis means having endometrial tissue somewhere outside of where it is supposed to be in the uterus. That includes in the abdominal pelvic cavity, like around the ovaries, or the ligaments of the uterus, or behind the vaginal septum, or somewhere in the pelvic peritoneum. A key in endometriosis is that there are typically multiple nodules, not just a single nodule. Another difference between endometriosis and leiomyomas is that leiomyomas do not respond to hormones of the menstrual cycle, But in endometriosis, the tissue is endometrial tissue that is misplaced. So that tissue goes through the menstrual cycle even though it's not in the endometrial layer inside the uterus. Therefore, we'll see the same kind of sloughing off and excessive bleeding from endometriosis, just as if that tissue was normal endometrial tissue. Since it's not in the right place, endometriosis is going to cause some pain and inflammation. Depending on where the tissue is deposited and what amount of endometrial tissue is deposited, it could lead to fibrosis and scarring and adhesions, or things sticking together. Unfortunately, the clinical manifestations include fertility. There's actually quite a few women out there that are infertile because of endometriosis, and depending on where tissue is deposited, it could hurt, called dysmenorrhea. Dyschezia means pain on defecation. Dyschezia is also a hallmark symptom of endometriosis, so when a patient has pain on defecating, females that is, that should lead you to start thinking about endometriosis. Dyspareunia is pain during intercourse, and constipation, although a little less common, is associated with endometriosis. Testing is straightforward, though through visually identifying the nodules. This can be done with a pelvic laparoscopy, as in putting the laparoscope in there, to definitively say whether or not there is endometriosis. This is a slide showing endometrial nodules scattered on the fallopian tubes, on the ovaries, and outside of the uterus. Just for the sake of completeness, the hypothesis of endometriosis is on this slide. Since we don't really know why endometriosis happens most of the time, there are some theories floating around. There are some people that think there's a backflow of blood with endometrial tissue in it, and that the tissue pieces are sticking to where it was carried. Therefore, they say don't do yoga inversions during menstruation, or turn yourself upside down, or some of that endometrial tissue may stick outside of the uterus. I personally don't buy into that. I think our bodies are a little more adaptable than that, but there are people out there that are much smarter than me that are saying if you do headstands during menses, you can get endometriosis. Another theory is based on the fact that the incidence of endometriosis is increased with first-degree relatives, so there might be a genetic component. And that ends our bleeding as an indicator of disease series.